Yeah, it's going to be a phenomenal year next year with the amount of change that's happening in the healthcare industry. I mean, the entire concept of compliance and regulatory issues will continue. So whether it's ICD-10, whether it's the health insurance exchanges, EMR, stage 2 is big. The EMR there's still many hospitals out there that have not yet implemented EMR. So we're going to see a lot of demand, and we continue to see a lot of that demand in terms of just making sure customers are compliant to the regulation that's out there. So that's the big number one on our list, and we see that demand will continue. There's no going to be no dearth of that demand. The second is what I would call more in terms of optimization and also in terms of integration, right? I kind of put them both together. EMRs have been implemented, but now what's next, right? How is the adoption levels going up? How can we help customers, physicians and the nurse practitioners actually use the EMR and not just have that system sitting there? So we're doing a lot of EMR adoption work. We're also going to do a lot more EMR optimization. You have to support, you have to do application support, you have to do system support. We can host a bunch of these EMRs. We're already doing a lot of that. Now that's the next wave. Implementation is done, these EMRs have gone live, but how do you optimize? Integration is kind of linked to that, because now that you have an EMR in place, how do you integrate these clinical systems with the financial systems, the operating systems, and then how do you put them all together? So I think that's going to be a big the second one in terms of what I just spoke about. The third big one, which we're going to probably see next year, is consumerism. We're already seeing that right now. So consumerism around predictive analytics, consumerism around mobility, right? Everyone's got some kind of device, right? Now, how do you get better patient engagement? How do you improve patient satisfaction? How do you improve, or no, how do you increase membership, right, for the health plans? How do you improve member satisfaction? If you want to check your benefits in terms of, hey, how much more money do I have before my if I start paying 100% of my copay and all of that. So that's going to be a big ticket item. Now that health plans are available, on healthcare.gov and in other, on websites out there, the health plans are talking about taking it to retail stores. That's part of consumerism as well, is you can walk up to a kiosk and buy a health plan. So we're going to see a lot of that. The predictive analytics is going to be huge, because you're integrating all this data, which I spoke about earlier. And what is the view? What is the integrated view? You have a big data view, you get in a business intelligence tool, which provides you all the information from the EMR, and then how do you connect that to all the different systems, financial, HR, all the systems within an organization, and still be compliant from a regulatory perspective. So that's one of the big platforms that we've launched as well, to bring all of this together. So I think it's going to be a fantastic year. We're going to be busy. We continue to be busy. We see a lot of integration work coming up, and a lot of migration, which is our bread and butter business. But then this whole thing around compliance, around integration, optimization, and obviously around the consumerism is really going to keep Dell services in the healthcare space at the forefront of everything. Thank you, Brian.
Thank you.